A record 1,400 deaths in just one day. But testing rates are low, and the true figures could actually be much higher. The World Health Organization has urged the government to introduce a stricter lockdown. Here's Jessica Washington with the latest from Jakarta.
Indonesia has now surpassed more than 3 million cases in total. What we have seen on the positive side is that the government has been able to ramp up testing, and they were able to test 200,000 individuals in one day, which is a marked improvement, however, still way off the target of trying to test 400,000 people each day. And you can imagine that in a country like Indonesia, there are, of course, people who would struggle when there is a strict lockdown. And many are doing it tough, particularly across Jakarta or Java and many parts of the country. But epidemiologists say that the government must act strongly because the situation is continuing to worsen. Intensive care units in hospitals, not only in Jakarta, not only in Java, but across the country are stretched, and we're seeing concerning signs of healthcare systems across the country in more regional provinces, including West Papua, where the healthcare resources are certainly not what we have here in Jakarta. And the numbers that you mentioned earlier, as concerning as they sound, and the fact that Indonesia now is Asia's COVID epicenter, they don't represent the reality on the ground because of low testing rates. Some local data agencies using data from cities, from provincial governments, say that the actual death toll is likely to be 3 to 5 times higher than what the government's numbers suggest.